COVID-19 Prevention Awareness. What can I do about COVID-19? We can all play a part in preventing the transfer of communicable diseases and spreading viruses. COVID-19 and the flu virus are easy to contract through close contact with people at work. The best defense is washing hands vigilantly, many times per day, with soap and water. This is the most effective means to prevent the spread of the virus and prevent against infection. Employee responsibilities. Complete pre-screening questionnaire accurately and honestly and return promptly to the office. Report symptoms immediately to protect fellow workers. Follow provincial health guidelines and company procedures to social distance and isolate as required. Remain healthy and active with these guidelines. Be vigilant about washing hands and hygiene using shirt sleeves to open doors. Wipe down surfaces with soap, water, or disinfectant, and do not cross-contaminate. Other personal measures for prevention. Wash hands frequently. Provincial authorities recommend vaccinations. Stay home if you are sick, so you do not spread the illness to other people. Use a tissue or cough and sneeze into your arm, not your hand. Turn away from other people. Use single-use tissues. Dispose of the tissue immediately. Wash your hands after coughing, sneezing, or using tissues. Do not touch your eyes, nose, or mouth. Viruses can transfer from your hands into your body. Do not share cups, glasses, dishes, or cutlery. Did we mention washing your hands frequently? When not to work. Anyone with COVID-19-like symptoms, a sore throat, fever, sneezing, or coughing must self-isolate. Workers who have traveled internationally. If you share a residence with a person that has been exposed to COVID-19. Workers who have been exposed to anyone confirmed to have COVID-19 or anyone with possible symptoms of COVID-19 should call HealthLink BC at 811 for an assessment and to determine any necessary next steps. What is my employer doing to prevent or reduce the spread of infection? We are committed to prevention of all communicable diseases and the spread of any viruses, including colds, flus, and COVID-19. We are progressive in our efforts to educate our employees, provide a hygienic working environment, stay current with public health advisories. Our training, orientations, hygiene, and disinfecting policies are constantly evolving. We are innovative in identifying new ways to manage our work and workforce without cross-contamination and utilizing isolation to protect our workers and the communities in which we work. What are the supervisor responsibilities? Supervisors must ensure both sanitation and social distancing are happening. Everyone must follow the procedures. Supervisors must observe, document, and correct if necessary. Supervisors must check the physical health of all workers daily. Maintain a daily log and health screening checklist of all employees present at camp. If someone presents ill, the supervisor must follow procedures and have the worker use the self-assessment tool. If a worker is required to self-isolate, refer to and follow the isolation procedures. Document all work absences, suspected communicable disease cases. Monitor for changes from the baseline illness rate and report to provincial authorities, alert phase, if 2 cases present in camp. Train workers in the worksite procedures to prevent contamination and exposure, especially physical distancing in their daily tasks. Share the exposure control plan and procedures with workers and post controls and procedures. Ensure workers use PPE, gloves and respirators, bandanas and masks, and trained how to use them properly. Ensure physical distancing, 2 meters or 6 feet, is maintained. Direct work in a manner that eliminates or minimizes the risk to workers. Have a work plan. Monitor all work activity. Document the observations and immediately correct non-conformance. All non-conformance events will be documented. Assist in the selection of controls to eliminate or minimize the risk of worker exposures. Ensure all related safety documents and records are properly maintained. Frequently asked questions. What does physical distancing look like in camp? How will I wash my hands enough in camp and on the block? How will my food be served? How will we maintain physical distancing during transportation? What additional PPE will be required? How will I do my laundry safely? What will community interface look like? What if I get sick? Physical distancing. We must practice social distancing recommendations, including avoid touch-based greetings, such as handshakes and hugs. Keep a distance of at least 2 arms length, approximately 2 meters or 6 feet from others. In camp, things will look different. Staggered meal times by crew, meetings more often by crew, spread out, tents spaced and with same crews, lines on ground at outhouses, dining tents, cash time staggered. Hand washing. We will have hand washing stations positioned throughout camp, some running water and some will be wipes and disinfectant, and we will expect people to be using them often. Hand washing kits in each vehicle with notices to wash hands prior to entering vehicle. Hand washing bottles, soap mixed with water, on the block, at caches, and for personal use. Hand washing designated sinks in camp, not dish sinks. Food and transportation. Food in a camp setting. Plates will be provided and kitchen staff will wash all dishes. All meals will be plated and served. Water bottles will be washed, disinfected, and filled daily by kitchen staff. Bring extra water bottles. Snacks packed for each crew, no snack tables. Lunches pre-made and packaged for each person. Sanitation between seating and in dining tent, plus before and after each meal. Transportation. Vehicles sanitized twice daily. Everyone travels with the same crew members each day. In first stages, everyone wears face masks in vehicles transporting more than one person. Restricted travel, journey management plans. PPE and laundry while tree planting. Personal protective equipment. Face masks, more often bandanas, will be required for specific tasks around reefer duties and traveling in vehicles. Gloves will be required to handle boxes for tree delivery, paperwork, and cleaning, and cooking tasks. Changes of clothes or aprons are required for some tasks, like taking down camp, as well as gloves and masks to reduce potential contamination. Laundry. Hand washing tubs and detergent in camps. Some laundry days provided in which a rover will take bagged and labeled dirty laundry to town for drop-off service. Typically costs about $1.60 per pound, with a minimum charge. Expect to hand wash more often, as laundry drop-off services will be inconsistent. Community interface. Blue-collar silviculture respects that communities may be fearful of groups of people like planters coming to their town during this period of time, and we would like to reduce that fear while still adding to the economic benefits of us working in the community. We also need to protect our workforce from potential community contamination, so our planters do not become sick. Journey management plans strictly monitored and documented for everyone coming out to start the season. Pre-screening questionnaires. You may need to delay your travel if you've been exposed. Restricted access to communities. No days off in town. Planned days off with provided camp meals. Camp moves strictly planned and monitored to reduce community interface and any potential contamination, including vehicle convoys, planned stops, fueling procedures. If you get sick while planting, first, all of the procedures and precautions developed are intended to prevent anyone from becoming contaminated. Isolating the camp, sanitizing constantly, and preventing any cross-contamination with food or water, plus physical distancing. Second, if you present with mild symptoms, an isolation camp setting is provided in each camp for you to get well while not contaminating anyone else, including regularly served meals. Third, if seriously ill but not requiring medical aid, a quarantine motel room will be provided to you to better address your healing while supported with meals. Fourth, we will be utilizing the provincially provided self-assessment tool to monitor your well-being should medical aid be required, and we will utilize ETV, first aid, medical responders, and emergency services in case any medical emergencies. COVID management and procedures. Screen all employees prior to accessing sites. Increase the sanitation efforts of common areas like eating facilities. In camp settings, hired additional help to complete required camp sanitation schedules and food preparation. Increase sanitation of handles, shared surfaces, and transportation vehicles. Reduce contamination in camp areas with significant change to food preparation and services. Provide isolation techniques where required and quarantine techniques if necessary. For additional information, please visit the following websites.